Hi, I'm Dr. Mark Rosenberg, and I'm here to talk to you today about the increasing incidence of cancer in this country. I'm an internist, but I'm also a cancer scientist, and I teach the first integrative cancer fellowship in the United States, the first and only integrative cancer fellowship. And the reason that I became involved in teaching an integrative cancer fellowship is because of the dramatic ongoing rise in cancer, not only in this country, but globally, although it is certainly rising at a much more rapid rate in this country than most other countries. And so we formed this fellowship so we can try to educate the other physicians out there, not only in preventing cancer, but in treating cancer, because many of you may not know, but for treating advanced stage cancers, we are no better than we were 30 years ago. And it's important that you understand what I mean. There was a large study that was published in the British Journal of Clinical Oncology in December 2004. And they looked at every randomized clinical trial in both the United States and Australia that claimed that chemotherapy extended 5-year survival. And here's what they found. In the United States, chemotherapy extended 5-year survival in only 2.1% of the cases. And in Australia, it extended 5-year survival in 2.3% of the cases. And that extended survival generally amounted to about 60 days. So we know that the standard treatment for advanced stage cancer is not good enough. So we've got to do a lot better, and that's the reason I started this cancer fellowship, so we can bring in MD, PhDs from all over the world, and we can all gather together and learn how to go well beyond the standard treatments for cancer. Now, why is cancer out of control? Is it simply that we're living longer? Well, that's not the case. And I say that's not the case because we're seeing a great increase in even childhood cancers. So it's not that. But what we're all probably aware of is that the toxins in the environment are overwhelming and constantly growing. It probably started from the Industrial Revolution and is continuing to increase. So there are an overwhelming amount of toxins in the environment, the air, the water, the food. Probably everybody's heard about BPA, bisphenol A, that's in all our plastic drinking bottles. Our water is severely contaminated. Our foods, when we eat beef, well, the beef cattle industry and the FDA endorse that all the animals get injected with 6 hormones, estrogen, progesterone, testosterone, and 3 synthetics. Many of our dairy cows are getting injected with growth hormone because it increases the production of milk. So the environmental factors are what's primarily responsible for the great increase in cancer. So what do you do about that? Well, first of all, on the preventive side, as I have mentioned, if anybody has seen my videos in the past, I talk about calorie restriction. The bottom line is, if all our food and water has toxins in it, the less you take in, the less toxins. Less toxins can decrease your incidence for cancer. So certainly, I would minimize my calorie intake. Well, that's one way. Another way to approach it is what food you do take in, you want it to be as organic. You want to get as much organic food as you possibly can because you don't want to get all those toxins in. So I do tell all my patients, I know it's hard, but whenever you can, eat organic food. Now, another question that I get a lot from my patients is what about red meat intake? And that's true. There are several studies that show a correlation with increased red meat intake and increased cancers, specifically prostate cancer, breast cancer, and colorectal cancer. So does red meat inherently increase your risk for cancer? And I have to tell my patients, I don't know. And the reason I don't know is because all those studies have been done with non-organic, non-grass-fed beef. So it may simply be the increased cancer is associated with the hormones that are injected in the beef. In order to know the answer, we would have to do a trial where we have one group of patients eating the normal non-organic beef and the other group of patients eating the grass-fed organic beef. Until that time, I personally stay away from red meat until that question is answered. So these are a couple of tips to decreasing cancer. There's certainly many more things that can be done. What I would tell anybody out there is is if you do have advanced stage cancer, you need to do your homework. You need to go above and beyond just the typical treatment. So you may want to seek out oncologists that are integrative oncologists that go above and beyond just the standard chemotherapy. But do your own homework. And once again, I want to clear out there that I'm not saying to the patients, don't do chemotherapy. What I am saying is for advanced stage cancer, you've got to do more. And that may include chemotherapy and many other things. This has been Dr. Mark Rosenberg talking about cancer and cancer prevention.